Welcome back to another episode of the BioHub. Today I'm joined by Dr. Paul Song, Chairman and CEO of NKGen Biotech. Paul has led across biotech from CMO at NKGen to co-founding Fuse Biotherapeutics. And since 2022, he's been driving NKGen's mission to harness natural killer cells through their proprietary SNK platform for neurodegenerative diseases and cancer. In this episode, we dive into his decision to return and lead NKGen, the science behind the SNK platform, the company's recent SPAC merger and NASDAQ listing, and his perspective on building resilient biotech companies in today's market. It's an absolute pleasure to have you, Paul. How are you?
Great. Thanks for having me.
No, honestly, a pleasure. Let's just start with your journey with NKGen and then what inspired you about the company's mission and the team.
So I actually was a practicing oncologist for over 20 years. I did always have one foot in the lab, so I was able to understand enough in terms of what the brilliant scientists were doing, but also enough to realize that I should really focus more on patient care. But about 15 years ago, I lost my own dad to cancer, and it made me reevaluate the way we were treating disease in general, and started to learn more about the role that natural killer cells play in human health, and was introduced to this company that had just launched, that had really been focused on trying to harness the immune system to tackle disease. So I joined the company as the chief medical officer, helped them initially navigate through the US FDA to get several trials up and running in cancer. And that's really how I first became involved with this. But as we went on, started to realize that natural killer cells had a lot of utility outside of cancer. If any of your listeners were able to do a literature search or put in Google natural killer cells or weak natural killer cells and correlate it with disease, you'll find thousands of publications that show that the weaker our immune systems are, particularly the natural killer cells, the more likely we are to develop everything from cancer to autoimmune diseases and such. So we set out initially to develop a process where we could take anyone's weak, deficient natural killer cells, grow them and make them very strong, and then give them back to patients to perhaps treat numerous diseases and improve human health. And that's kind of where we are right now.
Amazing. Yeah. And you left NKGen, right? And then you decided to come back. Can you just talk us through that decision and what motivated your return?
Absolutely. So I am an oncologist by training, as I mentioned, and our primary work was using these natural killer cells for cancer. But we started to see some early signal. We weren't sure why and how, but patients with some neurodegenerative diseases were actually showing improvement. And I was intrigued really with that aspect. And I remember having a discussion with the management team, how I thought this could be the future. But basically, the management team had brought in, quote, industry experts that said that using natural killer cells for neurodegenerative disease made no sense and we should focus on cancer. So in 2021, I left the company, but I didn't have a non-compete or NDA, so I was still free to try to figure out the mechanism of action of why and how NK cells might work for neurodegenerative disease. And over the course of 2 years, I felt like I was studying for a PhD in neuroscience. There was no prior precedent. There was no ivory tower that had been sort of touting this as a potential, but was able to come up with a pretty cogent argument and scientific rationale of why natural killer cells could affect not just Alzheimer's, but other neurodegenerative diseases like Parkinson's and Lewy body dementia. Ironically, when I figured that out, the founding CEO came back to me and asked if I would consider coming back to the company. And I said I would only come back if we made neuro the primary focus of the company. And he said he agreed, you could do whatever you want, just come back and run the company. And that's kind of how it all came back together.
That's amazing. That's amazing. Your science and technology are pretty innovative as well. So can you just explain the SNK platform and its potential on both neurodegenerative and on oncology as well?
Yeah, and first of all, for your viewers who are not familiar with what natural killer cells are, within the body, you've got basically 3 different subtypes of blood. You got your red blood cells that shuttle oxygen. You have your platelets that, stop bleeding. And then you have your white blood cells, which are considered the immune system. And within the white blood cells, the primary cell that people focus on a lot on are T cells, right? They're the ones that people have engineered CAR T products. They're the ones that seem to be a very essential part of our immune system to fight infection and disease. But little known within that are cells called natural killer cells. Now, natural killer cells represent about 4 to 15% of all the white blood cells in your body. But they actually serve huge roles. So think of a blind person using fingers to read Braille. Natural killer cells have 40 plus receptors that the natural killer cells police your body, and they use these receptors as they come across something to basically feel whether or not this is normal and should be left alone, or it's a diseased cell, whether it be a cancer cell, a virally infected cell, or even sometimes when your own immune cell goes rogue and is attacking your body. Natural killer cells, through these receptors, have the ability to identify them. And if they're competent and strong enough, they can eliminate them. But as we get older, or based on lifestyle, our immune cells can get quite weak. So we set out to develop a way to get these to grow. Now, the challenge is that natural killer cells are very, very difficult to get to grow. So the majority, if not all, the other companies in the natural killer space are using a universal donor, meaning they will screen thousands of samples of cord blood or stem cells and figure out which are those sources that they can reliably get to grow. A part of that is because if they take 100 random strangers and isolate the natural killer cells, most of them may be able to get like 30 out of the 100 NK cells to grow. What we showed the US FDA is whether or not we take cells from heavily pretreated cancer patients or healthy subjects, that we can get 100% growth. So that's really, I think, what sets our technology apart, in that you take 100 random strangers, we can isolate their natural killer cells and get 100% growth. But if you have weak and deficient natural killer cells, and all you're doing is making more weak and deficient natural killer cells, we would argue that's not going to be biologically beneficial. So not only can we get everyone's cells to grow, but we can make them more powerful. We can take your weak natural killer cell and grow them into very, very powerful, strong natural killer cells and restore sort of the immune integrity. The final part, as I mentioned, is those 40 receptors, right? Those finger-like projections that NK cells use to read the room. What we find is that, again, as you get older, not only can the cells get weaker, but the degree of sensitivity or the degree of expression is also decreased. So we grow cells into massive numbers of cells. We greatly increase the killing potential of natural killer cells, and then we cause a maximum expression of these receptors. So when we give these cells back to patients, we haven't genetically modified them, but we've optimized them. So when we give them back to patients, there's no side effects. There's no rejection because we have not genetically modified them. And that's how we're able to do this, and do this in a very, very safe way. And we're really the only company that has been able to show that we can take everyone's cells and do this for them.
That's amazing. I love that story. Yeah. I mean, like, this question is really relevant just in today's market. But what are some of the biggest challenges you've faced since inception? And also, how did you and the team overcome them?
So again, with regard to how we came across this for neuro, I wish I could say I was so smart that I was sitting in a room with prominent neuroscientists and said, I think natural killer cells would work for Alzheimer's. What happened was the founder of our company's father was sitting in a nursing facility with advanced Alzheimer's. He had not gotten out of bed, not been able to talk in many, many years. And this was pre-COVID. And the founder of our company said to me, do you think it would be okay if we gave him some boosted natural killer cells, not thinking it would improve his Alzheimer's, but really thinking that if we boosted his immune system, it would prevent him from getting an infection. So even before COVID, nursing homes were kind of like daycare centers that, one kid gets sick and they all get sick. One senior gets sick, and the amount of pneumonia or flu that spread was quite contagious. So he felt if I could boost my father's immune system, perhaps I would make him less susceptible, right? Because he wasn't getting out of bed and doing things. So we went ahead and took his blood and made some cells and gave it back to him, thinking that this would just reduce his infection risk. But what happened was shortly thereafter, the founding CEO said to me, "You're not going to believe this, but my father's talking to me." And I said, "Well, is he making sense?" He said, "Yes, not only is he talking to me, he's able to articulate what he's watching on TV.
Wow.
And not only that, he's able to now sit up in bed." He said, "Can you see if there's any scientific rationale why our NK cells might work in neuro and in Alzheimer's specifically?" So called some leading experts, called some friends that I went to medical school with, and I said, "Hey, do you know if there's any rationale?" And all of them came back and said, "No, it doesn't make any sense. There's no precedent or publications. It was probably just a coincidence." So just kind of said, "Oh, it's a coincidence," left it at that. About 6 months later, one of our employees came to me and said that there was a family member for which they were raising money for a GoFundMe page. And this was a young man, only 38 years old, who was in hospice with advanced Alzheimer's. At the age of 34, he had been working as a management consultant somewhere in the San Francisco Bay Area, started to act erratically, started to get lost on his way to work. And then he ended up at UCS Medical Center and was found to have this rare genetic mutation called PSEN1, which guaranteed before the age of 50, he would have full-blown Alzheimer's disease. So when we met him, it was 4 years later, and he was no longer able to walk, talk, or feed himself and required 24-hour care. And the family, because it's very expensive in the United States to treat such patients, had to raise money for this. So I reached out to the family and I said, I don't know if this is going to work. We had this one instance, maybe it was coincidence, but we know our treatment's safe. Might you be interested in us making this available? And the family said, yes, we're desperate. So we were able to get compassionate use approval. We took his blood and we started to treat him. And lo and behold, he went from somebody who could not walk, talk, or feed himself to doing all those things.
Wow.
Like to the point where and I actually had the head of Alzheimer's at UCLA, Dr. Ming Guo, independently see and follow this patient. And I remember after a few doses, she went back to see him and Dr. Guo called me and she said, what did you do to this guy? This is unprecedented. We never see anyone this advanced ever show any improvement. But still at that time, we didn't understand the mechanism of action. And then right after that, we decided, well, let's try it on one more. So we tried a more conventional Alzheimer's patient from New York. Same thing. She was not able to remember her kid's name. She could no longer walk, talk, or feed herself, and she was able to do those things. So based on all of that, I really felt like there was something there. But at the time, the founding CEO was talking to other people, industry experts, and they all said, no, this doesn't make sense. And that's when they decided to drop it. And that's where I realized it was time for me to go. So I would say the biggest challenge during the period of time is, even though I was able to put a cogent argument and scientific rationale together that satisfied the US FDA enough to give us an IND approval to start a clinical trial, the industry, the quote establishment all thought this was nonsense. I got a lot of responses like, it's too good to be true, it's placebo effect. Look, you're an oncologist, stay in your lane, you don't know what you're talking about. But because I was actually seeing patients improve in unprecedented manner, I couldn't dismiss it. So I felt like I needed to come back and try to fight for this, because I knew if I didn't, nobody else would, and this would have died years ago. So came back, got the IND, we started a pilot trial. We were able to draw samples of patients' cerebral spinal fluid before our first dose, after 4 doses, and then 3 months later. And we were able to show, one, that when we take your cells and put it through our proprietary process and we give them back to you through a simple IV, that they do indeed get into the brain. And not only are they getting into the brain to improve protein levels, so not just amyloid, but we showed that it also improves alpha-synuclein proteins, which are associated with Parkinson's disease, and tau proteins that are associated with the frontotemporal dementia. But we also showed we reduce neuroinflammation And more importantly, we were showing that patients were actually getting better. So as you know, the current treatments for Alzheimer's are, one, the approved drugs are only for the earliest stage, what we call the mild cognitive impairment. And all they're doing is slowing the level of decline. Nobody stops getting worse or anyone gets better. But we're showing time and time again that the majority of our patients are actually either stopping the decline entirely or actually really getting better. And we presented data at the most recent International Alzheimer's meeting in Vienna in June that showed that we've been able to convert patients from moderate stage Alzheimer's to mild. Like, we're actually showing patients have meaningful improvement as well as corresponding biomarker improvement, reduction in protein levels or improvement in protein levels, improvement in neuroinflammatory markers. So we went from nobody believing in what we were doing, everyone telling me to stay in my lane, to now getting major sites wanting to be part of our trial. The FDA looked at our data and felt convinced that there was something there, and they gave us fast track designation now for our work in moderate stage disease. And now we're actually treating other indications: frontotemporal dementia, Parkinson's disease. And so it's been a long struggle, but we're finally to the point where people don't view us as nonsensical.
One-off. Yeah. Wow. That's such an incredible story. Yeah.
And I'll tell you, it's only because it's easy to get dejected. It's easy to be want to give up. But it's because when you meet the families of these patients, not to mention the patients, and you see the profound impact it's had on them, right? So think of, like, if you have a loved one who has Alzheimer's disease, who is no longer capable of caring for themselves, you either have to have the means to hire somebody, or a lot of these people take time off.
Yeah.
They quit their jobs to take care of their loved ones. And think about if you've had to physically pick up your loved one out of a chair to take them to the bathroom, but now they can stand up and walk to the bathroom by themselves, and they can follow commands. When you meet these families and they tell you how it's had a profound impact, it's what drives me and keeps me going.
Rightly so.
Yeah, even when the medical community or the VC community just basically shits on you, you just got to keep moving along.
Yeah. Kind of moving on to that, like, VC community / financing. You guys went through a SPAC merger and listed on NASDAQ that way. Can you just walk us through that decision process? Because it's not as conventional, right? Like, what was the thinking behind it?
So remember, I mentioned that I left the company, and then the founding CEO asked me to come back. And when he asked me to come back, it was because he was about to close the doors on the U.S. entity because it was out of money. Over the period of time when I was away, they had adopted several plans and strategies that just didn't pan out. So really, it was last-ditch effort when he asked me to come back. So when I came back, the company was in such bad financial straits. We weren't even sure if we were going to make it another few months. And so I was given the opportunity to raise some capital through a SPAC merger. And because to do a traditional IPO was going to be too hard. If it was up to me, I would have wanted to remain private and independent as long as possible. But we decided to go to the markets with this SPAC and we were able to raise about $25 million. And the Korean parent company had actually agreed to give us $25 million as a backstop as well. So I figured that would give us enough money to execute till we reached our milestones.
Yeah.
Unfortunately, about 3 months after we went to the NASDAQ, the Korean parent company had imploded. So the Korean parent company was traded on the Korean stock exchange, the KOSDAQ, and the founding CEO and the company had some issues. So they got delisted and then subsequently declared bankruptcy about 5 months after we went to the NASDAQ. And because of the Korean parent company going bankrupt and all the issues there, everyone assumed there was something wrong with our science. So it caused a massive sell-off of our shares on the NASDAQ because a lot of investors in our company also had shares in the Korean company. And it almost killed us because not only did it cause our stock price to plummet, it caused people to question whether or not the science was real. And then remember, the Korean parent company had agreed to give us a $25 million backstop. They'd only given us 10 million before they went under. So we had a big cash shortfall. We couldn't raise any money because of the mess of the Korean parent company, and people were questioning our science. So for the next year, we basically almost closed the doors several times. I went almost a year without a salary. I still haven't really taken one.
Wow.
I ended up getting my mom, my sister, my mother-in-law to put money into the company just to make payroll. But the thing that we continued to do during this really difficult, tumultuous time was execute clinically and generate real compelling data. So it was a perfect storm of everything that could go wrong. So that was our quote path to the NASDAQ. But because of the Korean parent company overhang and then the drop, we fell below the $35 million market cap, and then we got delisted from the NASDAQ. We've been on the OTC exchange, but through all this process, because our science has remained strong, I've now been able to raise the money to acquire the Korean parent company out of bankruptcy, which we'll be announcing very soon. And then we plan to relist or uplist back to the NASDAQ or the NYSE probably before the end of the year. So we literally have emerged from the ashes due to no fault of our own, really the Korean parent company causing this. And now we're not only going to be taking over the Korean parent company out of bankruptcy, we'll consolidate all the IP, the global rights, everything. So it was no small feat.
I can't even imagine like the stress and resilience that you guys had, but like congratulations, like it's one hell of a story. And like
it's really a testament to the dedicated team that I have. We had to lay off 75% of our staff, but the 25% that have stayed with us they believe in what we're doing.
yeah,
They could have taken jobs elsewhere. Why stick around a company where you don't know if you're going to make it next month? But they see the profound impact that we're having, and they want to stay.
yeah.
They also, I think, see that myself and some of our management have gone without paychecks for, as they say, almost a year. And then I think also the fact that I was willing to get my own family to put money in just to keep the company going. Lastly, I'll just say that in those 2 years that I had left the company, I went and started another company in the cancer space. And we ended up selling that company a few months ago. I can't divulge the company that bought us yet as per the agreement, but the money that I made from that, I immediately rolled into our company now. And I think it just showed that how much I believe in the science, and then it started to open the gates for people to invest in us. So I guess the point being that left to my own devices, if I start my own company, I know what I'm doing and I can quickly turn it around. But inheriting a company that was run in a very different way, it's been the biggest challenge of my life. But again, the only reason I have come back is because I see what it can actually do to patients. And I knew that if I didn't fight for it, nobody would. But now we're at a point where the patients and the profound changes we're seeing it's so rewarding, and that's why that's what fueled me to keep going.
Yeah, I mean, it's kind of left me speechless, like what you've gone through to get to this point, and like you can see where it's going to go now, and it shows, right? Like the science will always come through. Tough market really like unfortunate circumstances. Like, I can't take my hat off to you enough in terms of what you've done. Like, it's incredible.
Well, again, we had to set a new paradigm, right? Because the whole Alzheimer's space is focused on just removing amyloid proteins.
Yeah.
What we found is that when we've all evolved with an immune system that technically can keep things in check. But as I mentioned, if we get older and our immune system starts to get weaker, or lifestyle changes, maybe they start to lose their ability to police. And this is why, people develop cancer and all sorts of things. But what we found is when we take your NK cells and we grow them into billions of highly enhanced active NK cells, we upregulate a receptor that allows them to get into the brain. And once they get into the brain, we've shown that they can help to not only digest and remove amyloid proteins, which is what majority of the drugs are focused on, but also alpha-synuclein proteins, which you traditionally see in elevated in Parkinson's or Lewy body dementia, and tau proteins, which is what you see in frontotemporal dementia. So we're able to show that your own immune system cells can get up there and reduce those levels or improve those levels in your CSF. And then the final part is, as these proteins accumulate in the brain, your other cells, the T cells, get up into the brain, and in their attempt to try to remove the proteins, T cells only have one receptor, so they can't distinguish between normal healthy tissue and disease. So they cause a lot of collateral inflammation and damage. So one of the things what we have found is if you just remove the protein but leave the inflammation and damage behind, this is one of the reasons we believe nobody's getting better with the current regimen. We found that your own immune systems, or our natural killer cells, all have the ability to get up into the brain to remove proteins, but also start to clean up those T cells that are attacking your own body. And in doing so, they reduce the inflammation and the neuronal damage. So it's a new paradigm, and it's pretty cool that this is not a drug. It's basically unleashing what our God-given immune systems at one point had the ability to do. And so that's what's great about it. There's no side effects with our treatment. And our goal is, right now, we're taking patients who actually have Alzheimer's and making them improve dramatically, right? So as I mentioned, the reason we focused on moderate stage Alzheimer's disease is these are patients that are no longer capable of independent living. They leave the stove on, or they walk somewhere and then they get lost, right? So they always need somebody to watch them. And we felt if we could improve them from moderate to mild, not only would that improve their lifestyle, but it would improve their loved one's lifestyle. So now maybe you don't need to watch your loved one all the time. You can go back to work, or you can leave the house for several hours to take care of what you need to do. And how transformative this could be, not only for the patients, but for the loved ones. And it represents about a third of all patients. So right now we have a randomized trial where we're giving patients placebo or our cell therapy. And we really expect to see real significant differences between the two groups in the middle of next year, and apply for accelerated approval. But once we're seeing it time and time again of patients improving, but once we show that, then the idea is to use it even earlier stage. So if you have the biomarker, maybe you don't have dementia yet. Now they know they can detect these biomarkers 10 years before you develop dementia. Imagine if we just give you a big bolus of your own immune cells that reduces all that before you ever develop symptoms. Our goal is to prevent people from ever getting to that point, and to do it safely, because it doesn't cause any brain bleed or anything like these other therapies. And that's where we believe the transformative nature of our therapy will be, not just in treating patients with disease, but giving everyone, it's going in for like an oil change, a couple times a year, where we just give you these enhanced NK cells to boost and tackle, disease. That's where we expect to have a real profound impact long term.
Yeah. I mean, the mission you guys on is amazing. I actually had the next couple of questions about current market and leadership, but they don't feel as relevant, like after the stuff we've just been talking about. I would like to ask you one last question though, which was what advice would you give to the younger people coming into this market and aspiring leaders for the future in biotech?
Well, one is I would say that if you're working on something that has never been done before, don't get discouraged when people don't understand it. And really be agnostic versus prejudiced, which I believe our medical community and the biotech community is. I find the biotech community is if one ivory tower place, like if it was invented at Stanford or Oxford or UPenn, then everyone immediately jumps on it, even if you look at some of those treatments never make it, right? Mm-hmm. But if it's somebody else that comes from a lesser known place or didn't come from the pedigree of a lab at Oxford, that all of a sudden the scrutiny is increased and the bar is much higher in terms of what you have to show before you even get funding. But I would say if you really find something that you believe in your heart, don't get discouraged and fight for it. That would be the first thing. The second thing is that the establishment is all a bunch of like even the Alzheimer's space, billions of dollars have all been focused on the amyloid hypothesis and no willingness to look at any other ways to treat this. In fact, there was an article by Stat Magazine that called it a cabal of how they really discouraged and squashed other alternative thinking. And I think that that's dangerous for us as a society. And I believe that we have to keep fighting for it. So again, it would have been very easy for me to be just disgusted with the establishment. Maybe if I was a young scientist and had not seen an actual human respond, I would have quit this a long time ago. But I would just tell people to really fight for what you believe in, set a new precedent, set new standards, set new scientific discoveries. Don't be a follower. I feel like, this is the time to really come forward with your new, fresh ideas.
Yeah, I'd love to leave the podcast there. That was so powerful. Thank you so much for coming on, Paul.
Thank you for having me, and really appreciate the work you guys are doing too.
Yeah, thank you so much. And everyone, please like and subscribe to the BioHub. Thanks again, Paul.
Thank you.